Let me just start this. Hello, Miss Whiteside.
Hi.
Hi, my name is Madison Sisco. I'm a physician assistant student at Thomas Jefferson University, and I'm just going to be working with your clinical team today just to get a history on you, if that's okay.
Of course.
Okay. So I just want to start right off with, what brought you in today?
Well, I've been having this shortness of breath for the past 2 weeks.
Okay. All right. So I just want to ask you a little bit about that so we can, see what's going on. So you said those symptoms started about 2 weeks ago.
Yep.
Was there anything that you were doing when they first started?
They happened when I was exercising.
Okay. Does exercising make it worse now?
It starts a little bit while I'm exercising, and then it gets really bad when I'm done.
Okay. Oh, I'm so sorry. Before we go any farther, can I just quick get your date of birth?
Of course. 10/3/1990.
Okay, thank you so much. All right, so when you're exercising, and does anything make it better?
I guess after probably like 5 or 10 minutes after exercise, and when I've been resting and I get some sips of water, then I start to feel better.
Okay. All right, so when you relax a little bit and drink some water, it gets better. Have you noticed your shortness of breath changing at all? Like, has it gotten better or worse since it started 2 weeks ago?
No, it really only happens when I think I'm exercising.
Okay. Has this ever happened to you before?
I feel like I remember something when I was younger, but I honestly can't say for sure.
Yeah, okay, that's fine. That doesn't apply. Okay, so, and it's only really during exercise. So besides the shortness of breath, are you noticing any other symptoms?
Well, I think right before my shortness of breath, well, maybe at the same time, I'm coughing too.
Okay.
And then sometimes I hear this weird squeaky noise in my chest, but I don't really know what it is.
Okay. And has that started just with the shortness of breath about 2 weeks ago?
Yep.
Gotcha. Okay. Does anything make the coughing better or worse?
Just the same thing with the shortness of breath. I just have to stop doing activity and drink some water.
Okay. All right. So besides the coughing and the shortness of breath, are there any other symptoms that are kind of bothering you right now?
Just that weird squeaky noise I hear, but nothing other than that.
Okay. All right. Well, that's definitely something I want to look a little bit more into. I'm just going to ask you a bunch of yes/no questions that kind of have to do with, your breathing. Okay. So you can just answer these with yes, no, and if I need anything else, I'll kind of specify that to you. So would you say that your cough is persistent or it's just sporadic when you're exercising?
I would say when it starts, it's pretty persistent until I stop doing activity.
Okay. And have you had any mucus with that cough?
No, it's pretty dry.
You have experienced shortness of breath. Would you say that you are experiencing wheezing when you have your shortness of breath?
I don't really know what that is, but it might be the squeaking.
You said the squeaking, okay. Yeah, I mean, wheezing is pretty vague, sometimes that's like gasping or any kind of, any kind of breath that makes a noise is something that we want to look more into.
Yeah, I feel like it's like I'm trying to get the air out and it just
okay.
won't go.
You're breathing out. I gotcha. Okay. When you take a deep breath in, does it hurt?
No.
Okay. Have you had any chest x-rays before?
Not that I can remember.
Okay. Do you know if you have asthma?
I don't think I have asthma. I feel like when I was a kid, I might
Mm-hmm.
have had I can't remember the name of those things, but a pump, I think they call it, a
Yeah,
pump.
okay.
I might have had
Okay.
that as a kid to use, but I haven't used that probably in 15 years.
Okay. And then do you know if you've ever had a pneumonia?
I do not think I've had a pneumonia.
And then do you have or have you ever had tuberculosis?
I've not had tuberculosis.
Okay, I'm just going to ask you a few more yes no questions about your heart then, okay?
Okay.
Have you ever had anything you would describe as heart trouble?
No.
Okay. Have you ever been told you have high blood pressure?
No.
Have you ever had rheumatic fever?
No.
Okay. Do you know if you have a heart murmur?
I don't think so.
Okay. Any chest pain or discomfort?
Nope.
Have you ever had heart palpitations when your heart beats really fast when you're not working out?
Nope.
Do you ever need to use pillows at night to help you sit up while you sleep?
Nope.
Do you ever have swelling in your hands, ankles, or feet?
Nope.
And you said you haven't had a chest x-ray. Have you had an EKG or anything like that done that you know of?
Nope. Not that I can think of.
Okay. All right, thank you so much. So, to try to get a better picture of everything that's going on and just to get, more about your history, I'm just going to ask you some other questions now about all different kinds of things. So I first just want to start out with any medications that you take now, whether that's prescribed or over the counter or herbal, anything like that.
Um, Sometimes I take ibuprofen if I have a headache, but that's
Okay.
pretty infrequent.
And that's just a pill, you take it by your mouth.
Yep.
Do you know how much you usually take?
I usually take 800 milligrams when I need it.
And do you think that helps your headaches?
Yeah, it does.
Great. Any other medicines?
Nope.
Okay.
Oh, actually,
Yes.
I take birth control.
You take birth control. Okay. Do you happen to know what kind?
It's called Trisprintec.
Okay. And is that a pill you take?
It's a pill I take by mouth. Yep.
Okay. Any other medications?
Nope.
Okay. Now I'm going to ask if you have any allergies to medicine, food, insects, any allergies at all.
I don't have any drug allergies, but I have a venom allergy to um, yellow jackets,
Okay.
and I'm allergic to cats.
And cats. Oh man. Okay. I want to ask you a little bit about both of those. So with the allergy to the venom of yellow jackets, if you were to get stung, do you know what kind of reaction you would have?
I feel like I would have, so the one time I got stung, they told me that or I felt like I couldn't breathe. And so
Okay.
my doctor prescribed me an EpiPen, but I never went back and got another refill, so I don't have one.
Okay. All right. Well, that's something that I'll make sure to send you home with today. Okay.
Great, thank you.
And do you know when you got stung by a bee last? Do you know when that was, or maybe how
I
old you
think
were?
I was maybe 8 years old, so
Okay.
maybe about like 20 years ago.
Okay. All right. That's great. You haven't been stung. Hopefully that does not happen again. But if it does, like I said, you are going home with an EpiPen. And then
Great.
when it comes to your cat allergy, what happens when you're around cats?
I just can't stop sneezing. My eyes are really red and itchy.
You know when the last time you were around a cat and that reaction happened was?
Um, Probably when I was a kid sometime. I've been around cats since, and as long as
Yeah.
I don't pet them and touch my face after, I'm usually okay.
Okay. Do you have any cats in the house?
I do not have any cats
Okay.
in the house.
And no allergies to latex or iodine?
Nope.
Okay. All right, now I just want to ask you a little bit about your childhood health. I know you already told me, about your allergies and how they affected you as a child, but I just wanted to ask you if you had any major illnesses or accidents or anything you can think of from when you were a child.
I think I was pretty healthy except for once I fell out of a tree and I broke my
Okay.
arm.
Okay. Do you know how old you were?
I think I was about 8.
And did you get a cast for that?
I did.
Did it heal all right?
It did.
Okay, great. Any other illnesses or injuries when you were a kid?
Nope, not that I can think of.
Okay, fantastic. Now I'm just going to ask you a pretty long list of some really specific illnesses. You probably haven't had most of them, but I just want to make sure, okay? So if you remember ever having any of these, just say yes.
Okay.
Have you ever had measles,
Nope.
mumps,
Nope.
rubella,
Nope.
whooping cough,
Nope.
chickenpox?
That's the one with the itchy red bumps, right?
Yes.
Nope, haven't had that.
Okay. Rheumatic fever,
Nope.
scarlet fever,
Nope.
polio,
Nope.
diphtheria,
Nope.
and you said no other kind of chronic illnesses that you remember from your childhood.
Nope.
Okay. Well, now I just want to ask you a little bit more about your recent illnesses besides what you came in with today, just, in your adult years. So around, since you're 18 or anytime around that, any major illnesses that you have had or been diagnosed with?
Um, nope, I think I've been pretty healthy.
Yeah? Okay. Okay, great. Same thing with how I just asked you about your childhood health. I have a few really specific diseases I want to ask you about. You can just say yes or no, okay?
Okay.
Have you ever had a history of hypertension, high blood pressure,
Nope.
diabetes,
Nope.
tuberculosis,
Nope.
hepatitis,
Nope.
any kind of coronary disease, so like a heart attack or anything like that?
Nope.
Okay. Any lung diseases?
Nope.
Do you know if you have COPD or asthma?
I know I just can't remember if they called it asthma, but I just know I had that pump thing when I was younger.
Do you think it was an inhaler maybe?
Oh, yeah, that's the word, an inhaler.
Yeah, maybe you had to use a tube with it, and sometimes that makes it. Yeah, I know a lot of kids for various things have to use some of those. Okay. That's something that I'll definitely want to note down just since you are having shortness of breath right now, they might not be related, but it's still something that is important. Have you ever had kidney disease,
Nope.
a thyroid disorder,
Nope.
HIV or AIDS,
Nope.
cancer,
Nope.
and any blood clots?
Nope.
Okay. Have you had any accidents or injuries in the recent years?
Recent years? Nope.
And did you have to go to a hospital for anything in the last few years?
Nope.
Okay, that's great. Did you have any surgeries?
Nope, I haven't had any surgeries.
Okay. All right, so now I'm just going to ask you about immunizations and some other screening things, just kind of in general. Do you get vaccinated? Do you know if you've had vaccines? You do, yes.
I feel like I'm pretty up to date for my job.
Okay. What's your job? What do you work as?
I'm a school teacher.
Oh, that's great. I'll definitely ask you more about that a little bit later. Okay, but so you think you're up to date on your vaccines. That's great. Do you get a flu vaccine?
I have to, yeah.
You have to? Okay. Have you gotten one yet this
I
year?
haven't gotten it yet for this year.
Okay, yeah. I know we're getting to that time. Have you had an HPV vaccine?
I have.
You have, okay. Do you know maybe when you would have gotten that?
I think when I was around 18.
18, okay. And do you go to a gynecologist?
I do.
You do, okay. Do you know when you would have had your last pap smear and if it was normal or not?
It was this year and it was normal.
Okay, great. And do you get a mammogram done there or no? Not yet.
Not yet.
Not yet, okay. Have you ever gotten a colonoscopy?
Nope.
Okay. Do you need to get TB tests done for school?
I do.
You do, okay. Do you know when your last one might have been?
It was this year, so it was probably, I think it was back in May.
Okay, and do you know if your results were normal?
They were normal.
They're normal, great. Have you ever had any cholesterol testing done?
I'm sure I have with routine blood work, but
Yeah.
I don't remember the date or the results.
Okay, that's totally fine. That's something I can look up. I like to just mention that since most adults, we try to, yeah, like you said, just have that done with their routine blood work. Okay. Now I'm just going to ask you a little bit about just specific women's health. I know you said you go to a gynecologist, which is fantastic, but I just want to make sure that, I have everything in your chart about you. That might be important to what's going on today. So, at what age did you get your first period?
I think I was 14.
Okay. And how often and how long is your typical menstrual cycle?
Mm. So it comes once a month, and I'm pretty regular because I'm on birth control.
Yeah.
And it lasts for, I'd say, about 5 or 6 days.
5 or 6 days, okay. Do you have any problems with that, or you think it's pretty regular because of the birth control?
It's pretty regular.
Okay, great. And would you say your flow is light, heavy, or medium?
I'd say pretty normal, probably on the lighter side.
Okay. Do you happen to know when your last period was?
It was about 2 weeks ago.
Okay. Do you ever have any painful periods?
Nope.
Okay. Your last pap smear, you said this year? Okay. Do you have a history of any sexually transmitted infections?
I do not.
You do not? Okay. And then, do you have any children?
I have 4 children.
4 children. Okay. And how many pregnancies did you have, whether they resulted in children or not?
So I had 3 pregnancies.
Okay. Okay, great. So you have twins?
Mm-hmm.
Awesome. Are they the youngest or the oldest or in the middle?
They are the youngest.
The youngest. All right. But you have your hands full.
Oh yeah, just wanted one more and got 2.
Okay. Now I just want to ask you a little bit about your family history because that can also be really important to your own health.
Okay.
So do you want to first just tell me about your parents and your kids and your siblings and just kind of your close circle?
Sure. So both of my parents are still living.
Great.
My mom is very healthy. She's probably like 50s.
Okay.
No, 67 years old, 67. Very
All right.
healthy.
I was gonna say she must be looking young.
And then my dad has a history of hypertension
Okay.
and AFib.
Okay.
And I would think hypercholesteremia, but
Yeah.
I'm going to not positive on that one.
I understand.
But he is about 69.
Okay.
Then I have 2 brothers, and they're both very healthy,
Okay, great.
no medical problems. And then my children are all healthy. They don't have any medical problems.
Okay, great.
Yeah.
Do you have any living grandparents?
I do not have any living grandparents.
Okay. Would you mind discussing how they passed away?
Sure. My maternal grandfather passed away from coronary artery disease.
Okay.
My paternal grandfather passed away from pancreatic cancer.
Okay.
My paternal grandmother passed away. I can't remember from what, but she had a fall and then her hospital course was complicated.
I understand. I'm sorry.
And then my maternal grandmother passed from old age, but I also know that she had Parkinson's and a little bit of dementia.
Okay. Okay, thank you so much for sharing all of that with me.
Sure.
I'm just going to ask some specific diseases, which once again, you can just tell me yes or no, but these are going to be in relation to if you know any of your family members who might have had these.
Okay.
Okay. Headaches,
Nope.
seizures,
Nope.
stroke,
Nope.
any mental illness,
Nope.
suicide,
Nope.
substance abuse,
Nope.
any thyroid disease.
Oh, my mom actually.
Okay.
She has hypothyroidism.
Hypothyroidism. Okay.
Forgot about that one.
That's all right. And coronary artery disease. You said your paternal grandfather,
Maternal grandfather.
maternal grandfather, anyone else?
Nope.
Okay. Hypertension,
Just my father.
your dad. Okay. And you said he might also have high cholesterol levels. Anybody else you think?
Not in my immediate family that I can think of.
Okay. Does anybody have diabetes?
Nope.
Does anybody have asthma or lung disease?
Nope.
Okay. Tuberculosis,
Nope.
kidney disease,
Nope.
arthritis,
Nope.
and any cancer in the family.
So my paternal grandfather with the pancreatic cancer, and
Okay,
then
yes.
one of my aunts had breast cancer.
Okay. Okay. All right, that concludes all of the family history I want to talk about right now. Thank you so much for sharing so much with me. Now, I also just want to ask a little bit about your social history, once again, just to kind of get the full picture of you and your health and, you know, all the information to hopefully help you reach a conclusion with what's going on with your shortness of breath. So I'm just going to start out by asking you where you were born.
I was born in Norfolk, Virginia.
And what was your childhood like?
It was great. I spent a lot of time outdoors playing. I played organized sports all growing up.
Fantastic.
Yeah, it was great.
Okay, good. And what was your highest level of education?
I got my bachelor's degree.
Okay. And you work as a teacher now.
Yep.
What school district do you work at?
I work in a small private school.
Okay. Are you guys in person right now or are you online?
We are virtually learning.
You're virtually learning, okay. So I guess this wouldn't really apply right now, but are you ever exposed to any hazards when you are in person at school?
Nope, not that I can think of.
Okay, the environment is okay, no really bad pollution, anything? Okay, great. I know this sometimes can be a difficult topic, but how's your financial situation? Are you stressed out about that or?
It could be a little better.
Yeah.
My husband, with all the pandemic and everything, he got laid off from his job, and
Okay,
so
I'm
we
sorry
could
about
be.
that.
Thank you. We could be a little bit better off, but fortunately, I'm still teaching.
Okay, that's great. I'm so glad that you're still able to keep your job. Is this something that's been really stressful for you and your husband and your family, or?
It's been a little stressful, I would
Yeah.
say.
Okay.
But he's looking for a job, so hopefully he'll get one.
Okay. Okay. Yeah. Great. Definitely. So you are married. You said your husband, and besides maybe problems because of the pandemic with money and stuff like that, do you have any other long-term stressors that are kind of bothering you right now?
No, not really.
Okay. And besides teaching and obviously being a mom, what else do you like to do in your free time if you ever have it?
Well, I was used to be really good with exercising, but then with the pandemic and everything, I stopped. And so that's what I've been trying to do is get back into it.
Fantastic.
So exercising, of course, spending time with my kids and my family.